Hello, this is Dr. Gabe from First Psych MRI, and this is a 16-year-old male who was involved in a motor vehicle accident, and they have wrist pain. We did an MRI here, and we can see right away that there is a problem. This bone here, this is the lunate bone. This is the ulna to get oriented. This is the radius, distal forearm. These are the carpal bones, and this middle one is the lunate bone. So the lunate bone, the ulnar half of this, is very bright, so it's a bone contusion or stress injury there related to that motor vehicle accident. Beneath that we have this dark band. This is the triangular fibrocartilage. That looks good. So this little cartilaginous band like a meniscus looks like it's intact. When we see a bone injury here, a lot of times the ulna will impact into there and they have injury here, but they also have a tear of the triangular fibrocartilage, but this patient does not have that. One thing we also notice is that the ulna is a little bit long. Normally it will end about the level of the distal radius, or actually a little bit more proximal to it, and it gives room for this triangular fibrocartilage. This one is too long, and the TFCC, this dark band, instead of going horizontal, is pushed forward. So this is what we call a positive ulnar variance. This is just congenitally too long, and this will abut into this lunate bone easily because the space is diminished. They often have tears of this triangular fibrocartilage, but again, this patient has a nice normal triangular fibrocartilage. So this is a bone bruise. Don't see a displaced fracture. There's one other finding. It looks a little funny on this view. Instead of looking like a normal lunate bone, it looks more like a piece of pie. It looks triangular. This is a view where it looks about normal, the normal orientation, but when we get to this view, it looks too high. Again, it looks more like a piece of pie or a triangle. So this shows that this is abnormally rotated. And when it gets abnormally rotated, the capitate bone here will migrate proximally. So we can say that this is subluxed in some direction, allowing for proximal migration of the lunate bone here, the capitate bone here. And we know they must have some sort of instability of the ligaments to allow this to happen. So let's look on the sagittal view. Most of the time we see this is related to dorsal subluxation of the capitate bone and tilt of the lunate bone backwards, but in this case we have more of a palmar tilt. So the lunate bone, instead of being tilted dorsally, is tilted volarly, and the capitate bone is migrated proximally, not behind it but in front of it. So this is what we call VISI, volar intercalated segmental instability. The palmar or volar ligaments are deficient, allowing this to rotate backwards, and when it rotates backwards like this, the cup is tilted and the capitate bone is pushed forward and drops proximally. These can go all the way to dislocate. This is not dislocated, just subluxed forwards. And right now there's no bad degenerative arthropathy. So this is just a case of ligamentous instability, and we call this VISI, volar intercalated segmental instability. And again, most often I see this is the other direction. The cup here, lunate bone, is tilted backwards, and we call that dorsal intercalated segmental instability.